We're part of a group from Amber Valley Borough Council. We've got something called Move More Amber Valley, which has got a range of partners across Amber Valley, including Active Derbyshire, Amber Valley CVS, Places Leisure, Belper Leisure Centre, Arch PCN, Public Health, the list goes on. But what we're really trying to do through that is to work as collaboratively as possible on the movement agenda.
I've been organising wellbeing drop-in sessions here at Somercotes Parish Hall, and people have been coming into the sessions and finding out about local services and activities. As a result of those sessions, people have been able to have conversations with Amber Valley CVS and Amber Valley Borough Council, and they've talked to people about what activities they would like in their local community.
We applied for some funding a couple of years ago through the UK Shared Prosperity funding through the Borough Council, and we decided that we wanted to put some sessions on to look at a kind of local community model of delivery for sessions. The reason this sort of came about was our work with Get Out, Get Active, which is funded through the Activity Alliance, where we've really worked on a place-based level for physical activity sessions, and we wanted to see how that could work in a different area of the borough, linking in being led by the community for the community. So yeah, informed by the data that exists, which is why we've been to Somercotes, Riddings and Ironville, but led by the insight of the individuals we've spoken to.
So GOGA's been running since 2016, so we've got a wealth of knowledge, insight and learning from the locality. So it's helped influence many programmes nationally, and also helped influence locally this programme in Amber Valley. It's a very place-based initiative, and it's very much around what people want. So the sessions are always co-produced with people.
So Monday we've got Tai Chi here at Somercotes Parish Hall. Wednesday we've got chair-based exercise, and also on a Friday, and then Friday evening we've got community boxing session. We've tried to make it a social element there, so we've done the tea and coffee. I mean, everybody comes and moves more and ends up being really social.
I bring my wife to the class who's had a stroke. She loves it here. It gives her a purpose. It helps her both physically and mentally, you know, with recovery. I bring her because I care for her at the moment, so everything we do, I've got to be there as well. But I enjoy it as well, the company. She loves the girls.
The focus is people with long-term conditions or disabilities to be active with those who are not, and very much about us not deciding what a session should be for those members of the community, but actually speaking to them and having a proper conversation.
I've been coming ever since it started. I found out about it from the doctor's surgery. They sent SMS text, and there was a variety of people here. There was age concern, there was no end of other people. I found out about the exercise class there, and I've been coming ever since on the Wednesday.
We've got 4 walks a month, 2 in Somercotes and 2 in Riddings. That was from the consortium, the engagement work, and involved with Walk Derbyshire. And a resident identified, actually, although the walks are very good, they don't support people with health challenges. And what was great about it, from identifying that problem, she went ahead and, with myself and some other residents from Somercotes, initiated a walk that's aimed at people with health challenges, mobility issues. So it's a very low level walk, and it's led by the actual participant.
We're not a car owning community compared with other communities. It's on the doorstep for them, and that helps them, you know.
So it's one of our focuses is healthy communities. So we're looking to get more into the community to provide an option for people that might be a little bit nervous about coming to a leisure centre setting.
I came here because I had an operation on my spine, and I'd had physio before the operation and I had physio after, but it wasn't really helping. So I got referred first of all to Alfreton Leisure Centre, went and did some Otago at Ripley Leisure Centre, but I don't drive, so the bus journey was just, it wiped me out. So I came here, because I only live up the road, and it's been marvellous because it's a reason for me to get up every Wednesday morning, get dressed, come out, and once you know the routine, it's really good. I really enjoy it.
Okay, I'm really enjoying it. It's good for my mental health, because I do suffer with mental health problems and agoraphobia. So it's not just a physical thing, it's also a mental thing. And they're getting out as well and coming and meeting different people. It's really clicked somewhere with me, this has. I don't know where it's like the leisure centre seems very busy, which is good, but here it is so quiet and calm.
I think with a couple more sessions I'll definitely get there, but I definitely recommend it to anybody because it's low impact, it's not exhausting, but you know, for somebody that just wants to get back into exercise, I think it'd be ideal.
So one of our places leisure instructors does 2 classes a week at this hall, and then we just, because we've got on our agenda is talking about health and well-being and healthy communities, because we know that not everybody wants to come into a leisure centre, so it's for us to get out in the community and get people that are less active to exercise, and so far that's worked out for us.
You get a lot of people that maybe don't want to go to the gym or perhaps can't drive or can't walk that distance, and so it kind of gives a little bit of accessibility, especially if you live in Somercotes in the village. And we have a little tea and coffee session at the end of each one. There's always the option to stay afterwards. It's nice warm to have a chat. We've all made quite friendly now. We had a little fuddle at Christmas, which was lovely, so yeah, we've all kind of made friends. So there's definitely that social element of getting people out. It's not just about the exercise, it's about the mental help that it can give as well.
One of the gentlemen that comes has a very high level of anxiety, to the point he's tried lots and lots of other things and just hasn't fulfilled it for him from his anxiety perspective. He's actually been here now for, this is his 4th week, and he has just found something that makes him come out of himself and relax. And he said it's the best thing he's actually tried. So, and he's stuck with it, which is lovely.